Welcome back. When it comes to understanding the impact of COVID-19, one group has been hit especially hard in Canada, seniors, and they remain the most vulnerable. So tonight we're focusing our special coverage on them. We'll look at the new challenges their doctors are facing and some of the extreme measures families are taking to see their loved ones. But first, let's hear from Canadian seniors directly and put their questions to our panel of doctors. With me tonight is Dr. Samir Sinha, Director of Geriatrics at the University Health Network in Toronto, and Dr. Nathan Stahl, geriatrician at Mount Sinai in Toronto. Thank you both for being here. So we have a whole bunch of questions. The first one comes from Grace, and let's have a look.
I'd like to know what steps are being taken for people my age who are thinking in the near future of moving into a nursing home or having care in my own home, in light of what's happening right now in nursing homes.
Okay, it's a big decision. Dr. Sinha, can you start us off?
Yeah, I think a lot of Canadians right now are really nervous about what my future care needs might look like, and is it safe to be in a nursing home? And I think right now there's a lot of work going on to save as many lives, but also to think about how we might have to rethink our models and provide more home-based care that's actually safer and more in line with what people like Grace would want.
Okay. Next up, we have a question from Corey.
I have well-managed type 2 diabetes. I'm wondering why I'm at greater risk for COVID-19. Is it my age, is it my illness, or is it a combination of both?
Okay, Dr. Stahl, that one's intended for you.
Yeah, so it's probably a little bit of both, but what's really important to recognize when we're talking about levels of risk when it comes to COVID-19 is that it's not just chronological age itself, and it's not just the presence of comorbidities. I'm sure we all know someone who's a 90-year-old who's in great health and great function, and unfortunately we probably know someone who's 60 years old who's in less good health and less good function. So it's a bit about moving beyond just chronological age. And similarly, when you speak about diabetes, there are people who have well-controlled diabetes like Corey, and hopefully a lack of end organ complications like heart disease. And so simply considering the presence of the comorbidity doesn't give us the entire level of risk. And we need to think a little bit about how advanced the disease is when we're talking about COVID-19 risk.
Yeah, you can certainly understand the how frightened people are. These are good questions. Up next, we have a question from Vivian.
Why is Ontario so slow to test all seniors and care workers in nursing homes?
Dr. Sinha, that one's for you.
Yeah, no, I think everyone's thinking that we need to be testing everyone as soon as possible, especially when 90% of our deaths right now in Ontario are in these homes themselves. But the challenge is that we only have so much testing capacity, with only about 14,000 tests a day and 144,000 people in care. Well, our focus right now in Ontario and other places is test as many people as possible in homes where there are outbreaks, and then start doing surveillance testing in other places. So we're trying to really manage our testing capacity as best as possible so we can try and catch up and even stay ahead of this virus.
Okay. Our next question comes from Jim.
My question is that if I have to go to the hospital, how do I make sure I'm not triaged as an expendable since I'm over 80 years of age?
Okay, that is a completely heartbreaking question. Dr. Stahl?
Yeah, so one of the things that's very important to recognize is that the success of our physical distancing in Canada has meant that we have not reached the surge levels in our acute and critical care systems that we thought we might have. And so these criteria, and I will say that none of them in Canada proposed using chronological age as a criteria, but we have not had to use those criteria to allocate scarce medical resources because we have not reached surge criteria. Now, other jurisdictions like the United Kingdom have developed similar criteria for the allocation of scarce medical resources, and mechanical ventilators would be one of those, intensive care unit beds would be another. And instead of using chronological age, other criteria are applied. That would be how advanced underlying chronic conditions are, or when it comes to aging, they've invoked a condition called frailty, which is a condition of a reduced function and health in older individuals. So simply the use of chronological age in and of itself is not something that's involved in those criteria, but I'm really hopeful based on the success we've had as a country in flattening the curve that these criteria will never have to be used.
Okay, our last question, which is one so many people are asking, comes from Margaret.
If we physical distance, is it okay to have friends, kids, and grandkids over for a visit in the backyard or the driveway?
Okay, so before you answer this, doctors, we know that circumstances are different in every province, and people obviously should first and foremost follow the public health guidelines where they live. But if you could both have a look at this, Dr. Sinha, how would you answer that one?
You know, this is the tricky one, right? Because we're all a bit stir crazy right now. We want to go and see our friends, and we say, well, you know, we'll all play safe. The challenge that we're having right now is that, especially young grandchildren, they don't understand principles of physical distancing. They want to hug grandma, and this is where people sometimes don't get it right, and that's how the virus actually gets us.
All right, doctors, thank you both very much, as always. And as we've mentioned, we will be asking your questions about COVID-19 every night going forward. So please send us the questions you have. You can message us directly on Instagram at CBC The National, or you can send us an email at covid@cbc.ca.